is Evenings with Peter Goers
on ABC Radio Adelaide,
South Australia
and Broken Hill.
Botox and vaping, for heaven's sake. Let's meet Dr Vivek Eranki, CEO of cosmetic services chain Cosmetique. Hello, Doctor.
Good evening, Peter. Thank you so much for having me on.
You retired from medical practice in 2021. Why?
I now work exclusively at Directorial and executive roles. As soon as we hit about 10 plus clinics, it's hard to balance both. And realistically, working in management is so much easier than working as a doctor.
Yes, indeed. And why do people have Botox, Doctor?
People have Botox for many reasons. Now, we are a cosmetic clinic, so the vast majority of people that come to us have it for aesthetic purposes. So the most common area where people get Botox is the forehead and the frown. And what Botox effectively does is that it reduces your dynamic wrinkles. So these are the lines that come about when you're expressing yourself. And there's also other uses for Botox as well. So some people get Botox into their jaw to help them stop clenching.
People with cerebral palsy use it.
Absolutely.
Urologists use it in the bladder.
That is correct.
Yes.
That is correct. And same with gynecologists as well for cervical dystonia.
Yes.
Dermatologists as well use it to stop people from sweating. So they inject it into people's palms, inject it into people's armpits.
Oh.
So yeah, it's got multiple uses actually. So yeah.
But it's a toxin, isn't it?
It is a neurotoxin, that is correct. But if it is titrated correctly, essentially you can use the toxin part of it for your benefit.
But mainly it's for vanity, Doctor.
We use it predominantly for vanity, that's correct.
Yes, yes. And it seems to be very prevalent. It has to be replaced. How long does it last?
Botox typically lasts about 3 months. There is a tiny bit of variability, but 3 months is pretty much the median.
Now, what are the dangers of vaping whilst you have a Botox? We couldn't quite work this out. It doesn't sort of melt.
That is correct. So what happens basically is Botox itself is injected into your body, and we are relying on the body to effectively transport the Botox into the part of your nerve cells, into the neuromuscular junction. So this is where the nerve talks to the muscle in order to make it harder for the nerve to talk to the muscle, and hence smoothen out the wrinkles.
Yes.
And by interfering with this pathway, what it does is it reduces the efficacy and the longevity of the Botox. And it has a similar effect with the fillers as well. So fillers are another very common treatment that we perform. And what basically happens is it reduces the efficacy and the longevity of the fillers. But especially with fillers, it also increases the risk of infection, bruising, and swelling as well. And the reason why we initially came across this is that we were in the process of opening several new clinics in South Australia, New South Wales, and Victoria. And we wanted to see if there's anything else that we can do to improve the longevity of the treatments, because effectively it's a purely elective service. So we want to make sure people enjoy the treatment that they receive for as long as possible. So then we did a survey on how many patients typically vape, because your traditional clinic just asks the question, do you smoke or drink alcohol? But no one specifically says, do you also vape? Now, what we found to be very scary is the younger somebody is, the more likely they are to vape. So in some clinics, which are predominantly frequented by young patients, up to 50% of the patients are regularly vaping. Patients that are slightly older are vaping at rates of about 25%, but this is still extremely high.
It is.
Exactly. And so what we then did is we amended our consultation. Well, our clinical team has amended its consultation to ensure that patients are aware of the risk and to essentially speak to them about ceasing vaping until at least for about 10 days after they receive the treatment.
And what is it in the vape, the vapor, that affects the Botox?
We don't know that yet because in a way there is nothing standardized about vapes, right? So the thing about cigarettes are that people know what's in cigarettes because it is fairly standardized. Whereas with vapes, there are so many chemicals in there to produce the flavors or the range of flavors that they advertise. We don't know what's in there. And just because we know what's in one brand of vapes doesn't necessarily translate effectively to another brand as well. We are only now realizing how dangerous vaping is. So if you look at the literature out there, with vaping, it was initially promoted as a very safe alternate to smoking. But now we are becoming more and more aware of e-cigarettes and vaping-associated lung injury, which are inflammatory changes that you see around the lungs. Yeah.
A lot of people came off tobacco to vape. But it seems largely pointless. And yes, you're right, there's a whole campaign against vaping, and vaping does seem popular and more prevalent among the young. Someone's asking, is Botox expensive? I don't want any, but I'm just curious.
Well, the answer is it depends. It depends on your desired aesthetic result. It depends on your age, and it depends on which area. Now, our ethos is to essentially, because Botox is a drug, it's a Schedule 4 drug, so we need to use the least amount of this drug possible in order to give you the desired aesthetic result. So for us, Botox typically starts around $40. So it's not very expensive at all. In the olden days, it used to cost a lot more. Even fillers, for example, fillers typically cost for us around $150.
And do you use it, doctor?
I personally don't, simply because I can't see my own face. I have nothing against Botox or fillers, but yeah, we always promote people to be very happy in their own skin. But if somebody is insecure about some wrinkles, we are here to make sure that it is erased away in as safe a way as possible.
Indeed. Well, it's been a very successful, very popular Botox. I can't quite understand why, but people who use it, and fair enough. I'm sure it's very successful for you, doctor.
It is a very popular drug, and we always promote the ethos of only have elective treatments if you need it. We are finding that more and more younger patients are more open to getting Botox done. So back in the olden days when I used to be clinical, I remember patients coming in not wanting anyone to know that they're having Botox done.
Yes.
They're paying cash. They basically organize a date with the girls afterwards so that all the bruising can, pretty much disappear, or they could put makeup on, or they organize it for when their partners are off in the mines.
Yes.
Nowadays, girls come in wanting to live stream all of their treatment.
Really?
Oh, absolutely. There has been a massive cultural shift.
Isn't that interesting?
In terms of Botox. Yeah. And a survey was done in the UK that looked at attitudes towards Botox and fillers among young people. Now, the scary thing is, a lot of young people look at Botox and fillers like they look at getting their nails done, or their eyebrows done, or their hair done.
Incredible. And it's become a status symbol, essentially, if you're live streaming. And your clinics allow people to live stream the procedure?
We feel very uncomfortable about it, but it is now become so prevalent that you can't stop people from doing it. So we have certain rules in place about privacy of the people that work there.
Extraordinary. Well, thank you for coming on the show, Dr. Vivek Eranki. What nationality are you, doctor?
I was born in India, grew up in the Middle East,
Yes.
and then I spent a fair bit of time in Karratha, and then I did my medical school in Adelaide, as well as I was a junior doctor in Adelaide for many years as well.
There you are. Thank you very much, Vivek, and all the best.
Thank you very much for having me on.
Fascinating.